Um, Next, I would like to introduce Debra Odo-Pent from the Health Education Council, who can talk to us about the impact of health in our community for those who struggle with healthy food.
Thank you. And, Councilmember McCarthy, I can't believe that President Clinton didn't come to your swearing. So I'm happy to be here today, and the Health Education Council is really pleased to have partnered on this 7-day food stamp challenge. My organization of about 35 employees, we participate, probably half of us participated in the challenge as well. I didn't make it the full 7 days, although I did try 3. And one of the things I think in the councilman's remarks about just the amount of planning it takes to really make, try to eat healthy and eat a nutritious meal with a very limited amount of money is really challenging. And so the Health Education Council, we've dedicated much of our work for the past 20 years on teaching folks how to eat healthy, how to improve their nutrition while on a budget. We also really try to work hard to partner with other organizations like the Food Bank to make sure that low-income communities have access to healthy foods, increased produce, seasonal produce, teaching communities, families, kids how to choose healthy foods while staying on a budget. We take families and parents on grocery store tours. We walk them through stores to tell them how to select food. We teach them how to cook, how to prepare, and most importantly, I think, as many of us have learned during this challenge, how to plan. We know that obesity, there are two of our most preventable causes of death today are tobacco and obesity is a major public health epidemic. Ironically, when we think about hunger, we would think that we don't have enough food, but ironically, low-income communities have a disproportionate burden of obesity and related chronic disease problems than those with higher resources. This is often true because low-income folks who have limited access to healthy foods rely more heavily on non-nutritive foods that aren't high calorie dense but have lower levels of nutritive value. So low income and those who don't have secure sources of food are especially vulnerable to obesity, not only because of their limited access to food, but also other risk factors associated with poverty, including limited resources for physical activity, and living in environments that are less conducive to health. A lack of access to adequate food and nutrition is a very serious problem. Many families struggle to put food on the table every month, and many adults skip meals, and ironically, skipping meals is across all income continuums is very highly associated with increased rates of obesity. Simply put, poor nutrition leads to poor health. We do know that food and nutrition programs such as CalFresh and direct nutrition education are critical to the health and improving the lives of low SES communities. These programs, nutrition education, increasing access, encouraging folks to enroll in programs like CalFresh, can increase knowledge of healthy behaviors and create behavior change that really sustains and prevents chronic disease and illness. There have been some recent reports out of the Institutes of Medicine and the White House Task Force on Childhood Obesity, which also clearly state that participation in programs like the CalFresh program and nutrition education are important strategies to reduce the obesity epidemic. So the Health Education Council really looks forward to continuing our partnership with the River City Food Bank and the other important agencies working so hard to end hunger and increase health in low-income communities. Thank you.